Medical Information Booklet, BBS UK, Bardet-Biedl Syndrome UK. Acknowledgement. This book has been funded by NHS UK and produced by Bardet-Biedl Syndrome UK, BBS UK. Registered charity number 1181244. It is important to note that there are many symptoms and conditions listed within this booklet that may affect those who have BBS. But they may not necessarily affect everyone, and the severity of individual symptoms can vary greatly among those affected. Our grateful thanks go to the clinicians from the BBS Specialist Clinics team at Queen Elizabeth Hospital, Birmingham, Birmingham Children's Hospital, Great Ormond Street Hospital, London, and St Thomas's Hospital, London, for their contribution to this publication. Our heartfelt thanks also go to the generous individuals living with BBS who contributed to this booklet. Their guidance and personal perspective have been invaluable. www.bbsuk.org.uk. Quote, "There's no one else who knows our child like we do, and we have to take this on board and make ourselves heard. We have to be an equal partner with medical, social, and educational teams, and believe that we're an equal partner. We have to use the resources available to us to give our children the confidence, courage, and self-esteem to know that they have a great deal to contribute to this world." End of quote, parent. The origins of Bardet-Biedl syndrome. The first formal description of Bardet-Biedl syndrome, BBS, appeared in the 19th century, in a paper by London ophthalmic surgeon John Zachariah Lawrence and his house surgeon Robert Moon, 1845 to 1914. Moon's father, William, had invented one of the earliest raised alphabets for the blind. BBS remained largely unmentioned until 1920, when Georges Bardet discussed hypothalamic obesity in his MD thesis. In 1922, Arthur Biedl independently described two siblings with retinitis pigmentosa and polydactyly, without referencing Lawrence and Moon's work. In 1925, Solis Cohen and Weiss rediscovered the Lawrence-Moon paper and grouped these conditions together under Lawrence-Moon-Biedl syndrome, LMBS. This remained the standard term until the 1980s. More recently, the condition has been divided based on clinical features into Lawrence-Moon syndrome and Bardet-Biedl syndrome. Bardet-Biedl syndrome represents by far the majority of published cases and is now the more generally recognized term within the medical and scientific community. 1. Introduction. Bardet-Biedl syndrome is a rare inherited disorder affecting approximately 1 in 100,000 babies born. Many GPs, doctors, and health professionals will not have come across BBS or have heard of the syndrome before. Features of the syndrome include rod cone dystrophy, a progressive eye disorder that leads to blindness, characterized by tunnel vision and night blindness, obesity, renal abnormalities, developmental delay, speech and language difficulties, extra fingers and/or toes, and learning difficulties. Not all of the features are always present in those diagnosed as having BBS, and each one can vary in severity and appearance. The variability in presentation and severity of the symptoms, together with the rarity of the syndrome, can lead to delayed diagnosis and a lack of adequate local health care. This booklet is aimed at the medical and healthcare professionals involved in the care of BBS patients, to promote a greater understanding of the syndrome and the recommended care pathway. The information has been provided and checked by the BBS Specialist Clinics team and where available, is supported by research and published articles. A bibliography of references and useful publications can be found at the back of the booklet. For further information, contact admin@bbsuk.org.uk.